Okay, good day. So, today tayo po ay nasa Session 2 to April 2, 2020. So, just like what have been mentioned during our previous session, our overarching theme sa ating apat na session ay ensuring HIV Continuum of Care during COVID-19 crisis in the Philippines. Okay. Our part 2 is about assuring HIV continuity of care during enhanced community quarantine, which will be presented to us by Sir Bench Baguingan. He is the Regional HIV/AIDS and STI Program Officer, Metro Manila Center for Health Development.
Hello, good morning everyone. I'm Ed from Ship ulit. So, nasa session 2 na tayo. Diniscuss na ni Rod yung mga magiging topics natin for today. And, again, reminders lang, yung mga questions, I believe may mga na-submit ng mga questions. Importante yung mga questions na yan dahil sabi nga ni Doc Kate nung first session natin, on a daily basis, may pabago-bagong update dito sa COVID-19. So kung mayroon kayo mga bagong questions while ginagawa natin itong broadcast na ito, please feel free to send it through the chat room. Now, let's start na, no? Kay Doc Jello tayo magsisimula. And if ever mayroong questions, tapusin muna natin yung ating mga speakers. Tapos, pwede naman tayo mag-send in ng questions through the chat room. Okay.
Ayan. So I was tasked to discuss assuring HIV continuum of care during enhanced community quarantine here in Metro Manila. So here are my topics. First, we'll be discussing about COVID-19 updates and followed by HIV/AIDS epidemiology. And next is the DOH issuances on HIV/AIDS and HIV service delivery and continuum of care, and at the same time, yung mga frequently asked questions natin. So ito yung mga COVID-19 cases natin validated as of April 1, 2020, 5 p.m. Ang global cases natin ay umaabot na about 754,948 cases. Ang deaths na natin rose up to 36,571. Ang countries affected natin, 202. Sa Philippine setting naman natin, meron na tayong 2,311 cases. Ang recovered natin ay 50. Ang deaths naman natin ay 96. Now here in the National Capital Region, 16 out of 17 LGs reported cases of COVID-19. And in Metro Manila, we have 501 cases. Ang reported deaths natin ay at 56. Cases discharged or mga recovered cases natin ay 19 cases or 19 individuals. Ang mga PUI tested for COVID-19 naman natin with negative result ay 2,536. So ito yung mga per LGU naman natin, COVID-19 cases natin. Manila, 44 cases, 8 deaths, recovered 3. Makati, 54, deaths natin 3, recovered 4. Mandaluyong, 25, ang deaths natin ay 2, recovered 0. Ang San Juan, 87, ang deaths natin 8, recovered 3. Muntinlupa, 13, 0 ang deaths natin, recovered 0 din. Parañaque, 37, deaths 0, recovered 0. Las Piñas, 15, deaths 0, recovered 0. Pasay, 13, 0 deaths, and then 1 recovered. Ang Caloocan, 12 cases, deaths 3. Malabon, 0, 3 cases, 0 deaths, 0 recovered. Valenzuela, 3 deaths, 0 recovered 0. Pasig, 32 deaths, 4 recovered 1. Pateros, 2 ang cases, deaths 0 recovered 0. Marikina, 16 deaths 2, recovered 0. Taguig 19, deaths 1, recovered 2. Quezon City 126, deaths 23, recovered 5. So next is on the HIV/AIDS epidemiology. So this is the summary of HIV diagnosis and deaths as of December 2019. So we have the demographic data. As of December 2019, January 1984 to December 2019, we already have a total reported cases of HIV of about 74,807. 9,265 has an advanced HIV infection, and male 70,197, female 4,599. Median age natin 28. Age groups less than 15 years old, we have 217. 15 to 24 years old, we have 21,492. 25 to 34 years old, 37,998 cases. 35 to 49 years old, we have 13,042. And 50 years old and above, we have 1,975. Reported pregnant women, 390. And reported deaths, 3,730. Here in the National Capital Region, we have the HIV care cascade as of December 2019. We have an estimated PLHIV of about 33,580. 82% were diagnosed, or 27,382. Among those diagnosed PLHIV, we were able to enroll 19,190 on antiretroviral therapy, and 85% of it, or 16,399, were retained on antiretroviral therapy. So this is sourced from the AIDS epidemic model as of March 2020, and the HARP, or the HIV/AIDS and ART Registry of the Philippines, as of December 2019. So let me show you the slides on the number of PLHIV dispensed with ARVs in Metro Manila. So we have two types of PLHIV, those that are in-house PLHIV, or those PLHIV that are enrolled in their originating treatment facility. And we also have a transient PLHIV, which means that these are PLHIV that are not originally enrolled in their treatment facility, that they are accessing antiretroviral drugs. So among those in-house PLHIV, Metro Manila were able to dispense ARVs to 8,024 individuals. And transient patients naman natin, 422, which is 5% of the total number na nabigyan ng gamot, which is 8,446. Now, kung titignan natin dito, 72 out of the 422 individuals, or 17 patients ng mga transient PLHIV natin, are non-NCR enrolled PLHIV. So they are coming from Bulacan, from Cavite, from Tarlac, Cagayan. We also have patients coming from Visayas, Eastern Visayas, Central Visayas, and even in Mindanao. Now, if you have seen the total number of enrolled case natin, PLHIV on ERT natin, which is 16,399, about 49% of the total number of enrolled PLHIV here in NCR have already accessed or availed their antiretroviral drugs. So we are still expecting of about 51% of the total number of enrolled PLHIV natin na mag-access ng antiretroviral medications in the coming 2 weeks. So ito naman ang mga DOH issuances natin in relation to the enhanced community quarantine here in Luzon. So the Department of Health has issued a guidelines on the service delivery of people living with HIV affected by community quarantine. So we have the general guidelines. PLHIV affected by community quarantine shall be provided services by HIV treatment facilities. So dalawa ang type natin ng HIV treatment facilities. First, we have treatment hub. So what is a treatment hub? These are primarily hospitals. So they are catering inpatient and outpatient PLHIV. So we also have the other one, which is the primary HIV care facility or clinic. So these are facilities, not a hospital, which are catering OPD patients or mga outpatient PLHIV natin. So stated under the general guidelines, PLHIV residing in areas under community quarantine. Next, PLHIV whose treatment facilities are located in areas under community quarantine. The next is PLHIV who are foreign nationals who are affected by community quarantine. So let's move forward on the specific guidelines. Number one, all DOH designated treatment facilities, whether treatment hub or primary HIV care facility, shall temporarily cater to above mentioned PLHIV and shall be provided with the following services. So first, a refill of ARV shall be good for 1 month. Medical consultations, including laboratory examinations for PLHIV, suspected to have a clinical treatment failure. So andito na yung mga drug resistance tests natin, andito rin mga viral load testing natin. Applicable po siya under B, Section 1 of the specific guidelines. Number 2 naman is any foreign or foreigner shall be provided medical consultation and the needed ARV medication appropriate for the duration of days the person is going to stay here in the Philippines. So kung ang isang foreign national will be staying here 30 days during the implementation of the enhanced community quarantine, then the patient must be provided with antiretroviral drugs that is good for 30 days. But there should be an additional buffer of about 5-day supply for inter-country transit purposes, but not more than 1 month supply under the following conditions. So ano yung mga conditions na yun? PLHIV who lost their ARV due to unfortunate circumstances. We also have PLHIV who ran out of ARV stock due to unavoidable circumstances and need to stay in the country for an extended period of time due to community quarantine. And then the next, PLHIV who can reach out to any HIV treatment facilities, community-based organization, community centers, community-based organizations, and civil society organizations about their ARV supplies. The HIV treatment facilities shall of course be responsible for the following. So mag-establish sila ngayon ng validation methods to determine yung HIV status ng patients natin or at the same time yung ART status ng mga patients natin. So ano yung mga validation methods na ina-expect natin from the different HIV treatment facilities? So it could be an HIV confirmatory result, it could be a clinical abstract, it could be HIV treatment booklet, among others. And then next is report the number of clients served every day or every end of the day through an online spreadsheet to be shared to concerned facilities. So ang gumagawa na nito ay yung mga treatment hubs, mga treatment facilities natin, including of course yung mga centers for health development natin. And the role of the Center for Health Development or yung mga DOH regional offices is to allocate and realign HIV commodities within its jurisdiction as necessary. So in the yesterday, we were able to allocate and realign HIV commodities here in Metro Manila, and transportation or distribution arrangement of the said commodities will be happening this week up until next week. Next is updating of the directory of treatment facilities with identified point person for facility to facility validation of PLHIV. So at the end of the discussion, we will be providing you directory of HIV treatment facilities here in Metro Manila, and at the same time, directories of HIV treatment facilities in other regions as well. And then next, number 5, provision of services shall be extended until quarantine is lifted. So apart from the service delivery guidelines on the access of different HIV services during the implementation of enhanced community quarantine, the Department of Health has also issued an advisory regarding access to antiretroviral drugs amidst the enhanced community quarantine. So ano yung una? Use of available courier services for pick-up and delivery of antiretroviral medications. So ito ay yung isang concern ng mga PLHIV or yung mga patient natin, yung cost or yung financial cost ng mga courier services. So yung cost of the service ng courier services natin may be shouldered by the HIV treatment facility. It could be shouldered by the client, the community-based organizations, or it could be sourced from the PhilHealth outpatient HIV/AIDS treatment package natin, among others. So those are the options for fund resources to pay for the cost of the courier services. The next is HIV Treatment Hub designated ARV access points. So HIV treatment facilities may designate an LGU facility, any LGU facility, or they can designate community-based organizations or community centers para maging isang ARV access points. Especially important for big treatment hubs natin kasi madami tayong mga PLHIV na ayaw pumunta sa mga big treatment hubs due to influx of COVID-positive patients natin. So big HIV treatment facilities are now determining facilities or any areas kung saan pwede nila makapagbigay ng mga HIV services such as ARV refills, including, of course, medical consultations. Next is use of LGU vehicles for delivery of ARVs at the agreed meeting points. So here in Metro Manila, we have Taguig City who are actually doing personal delivery of antiretroviral medications sa ating mga patients. They are na within Taguig local government unit or Taguig City. And the next isang concern nila is the entry and exit of PLHIV in areas under community quarantine. So pwede natin gamitin any electronic or SMS appointment information as proof of entry of PLHIV. So under community quarantine. So next naman natin na topic is the service delivery for HIV/AIDS. So paano nga ba yung access natin to HIV services? So ang gagawin ng patient natin is to get a copy of the directory of HIV facilities, which I will be providing to you at the end of the session. And the next na napaka-important or critical is to contact your originating HIV facilities or to your preferred or your closest HIV treatment facilities ahead of time to be aware of their facility protocols and at the same time their operating schedules, among others. So napaka-important din na i-coordinate yung concern ninyo muna sa inyong originating HIV facilities kasi sila ang magre-refer sa inyo papunta rin sa preferred HIV treatment facilities ninyo. So bakit napaka-importante na i-contact yung originating HIV facility ninyo? First is for the preparation of your medication or yung antiretroviral drugs ninyo, especially if you have a second-line medications such as those drugs incorporating lopinavir-ritonavir as a second-line medication ninyo. So not not all HIV treatment facilities have supplies for second-line medications. So kailangang malaman muna ng originating facilities ninyo kung yung preferred HIV treatment facilities ninyo ay may ganoong supply. Okay? And then next is bakit nyo i-contact ang HIV treatment facilities niyo? First is to determine whether your HIV facilities are catering for patients who are in need of courier services, or kung yung mga facilities ninyo ay may capability na mag-provide ng courier services or delivery options to their patients, or kung ang meron lang sa kanila ngayon na option is for pick-up, so kailangan malaman ninyo yung mga ganung bagay. Next na napaka-important is of course to network yourselves with community-based organizations and PLHIV community. And the next is access to ARV refill. Sa guidelines natin, it says that refill good for 1 month supply. And the next is there are different types of access to ARV refill. We have pick-up. You have an option to do courier services or delivery. So yung courier services natin dito sa Metro Manila, we have Angkas, we have Lalamove, we have Grab, we have also LBC as an option. When it comes naman sa mga medical consultations, you can go to the facility on site, or you can also opt for an online consultations through telehealth. Other communication platforms such as SMS, electronic messages, phone calls, video chats, and email can also be used. So next naman, nung tinitingnan ko actually yung mga mga logistics supply, kasi ito yung concern ng mga community natin kung sapat ba ang supplies natin. Nung chinek ko yung supplies natin, for the first line drugs natin, stable naman ang supply natin from 5 months up until 11 months supply natin. So yung mga second line drugs natin, 4 months up until 10 months yung supply natin. So ano yung mga frequently asked questions regarding HIV and COVID-19? So in-receive ko, I don't have transportation to go to my HIV treatment facility. So what are my other options? Next is you can use available courier services. Sinabi ko kanina, yung Grab delivery, Angkas, Lalamove, or even LBC for pick-up and delivery of ARVs. Use of designated LGU facilities or CBO as an ARV access points. They can also use LGU vehicles for delivery of ARVs. So you have to communicate this first to your primary HIV care facilities or HIV treatment hubs if they have prior coordination with the LGU for the utilization of their vehicles for the delivery of antiretroviral medications. They can also use electronic or SMS appointment information as proof for entry of PLHIV into areas under community quarantine. The next naman is, my HIV facility is too far from my home. Can I get my ARV refill somewhere else? Yes, you have your ARV refills at any HIV facility near to you. But you have, of course, to coordinate this first with your originating HIV treatment facility for a better or smooth transaction. So you also have to prepare your ARV booklet, confirmatory result, your universal ID code or your UIC, and clinical abstract. However, if you don't have any of those, okay lang naman po. Basta you just have to coordinate this with your originating HIV facilities, and you have to disclose na wala kayong any ARV booklet, among others, na maipresent nyo sa inyong mga preferred HIV treatment facilities, merong nagawang mechanism dyan. Yung receiving HIV treatment facility will just confirm your HIV status and your ART status with your mother hub or yung originating HIV treatment facility ninyo. So once verified na yung ART status nyo or yung and at the same time your HIV status, bibigyan naman po kayo ng receiving facility ng good for 1 month ARV supply. So to find HIV facilities near you, you may use available online tools such as yung Upland ARV Ayanihan or yung HIV Facility Near Me. I will be providing to you yung link kung saan ninyo ma-access ito. You can also contact yung mga CBO groups natin, yung PLHIV network for additional assistance. So where are the HIV facilities near me? So ito na yung yung links natin. So meron tayong link dyan, tiny.cc/Oplan ARV Ayanihan. And we also have tiny.cc/HIV Facility Near Me. So maganda ito kasi nakaplot na, meron na tayong map. Nakaplat na yung mga sites, access sites ng ARV natin and for medical consultations. And at the same time, makikita nyo doon kung saan yung mga checkpoints natin. Kung clear ba yung road na pupuntahan nyo, kung may obstruction ba doon or hindi. We also have PLHIV Response Center. So ito, naka-show na dito yung hotlines nila and their mobile phone numbers and at the same time their email address. Next is I need to go to my HIV facility for a consultation. Can I pass through checkpoints without disclosing my HIV status? Currently, you may be required to present a documentation at checkpoints. This includes but not limited to home quarantine pass, your ARV booklet, confirmatory result form, medical certificate. Although, kung wala kayong ARV booklet or confirmatory result, medical certificate, it's okay. Nakalagay naman doon sa advisory natin na even the use of electronic or SMS appointment is sufficient enough for as a pass for entry and exit in areas under community quarantine. However, should these documents not available, you may opt to have your ARV refill delivered through your home through courier services. Next is I don't have any ARV booklet nor my confirmatory result with me. Can I have my ARV refill? Sabi ko kanina, if you don't have any an ARV booklet or your confirmatory result, verification with your home treatment hub or primary HIV care facility may be done by the transient treatment hub or treatment facility or your preferred or your nearest receiving HIV treatment facility. Just prepare your universal ID code or your UIC when you contact your HIV treatment facilities. Next is I am a no work, no pay employee. Where can I get financial assistance? You may contact your local social welfare and development offices. So we have the MSWDO, CSWDO. We also have the provincial CSWDO. Regional offices of the DSWD or DOLE for assistance. You may also contact community-based organizations who can help you to avail government assistance. Next, I am feeling worried, sad, anxious, or scared. What can I do? So, I will show sa slide natin yung mga links where you can access psychological and mental health support or assistance. We have Psychological Association of the Philippines. We also have UP Diliman Psychosocial Services. We have National Center for Mental Health, COVID Hotline. We also have the UP Diliman Psychosocial Services. Next is I have, if I experience discrimination based on my HIV status, where can I get legal assistance? You may contact the Commission on Human Rights and community-based organizations providing legal assistance. So we have the hotline ng Commission on Human Rights, so 82948704. They have also the mobile numbers, TMN Smart. We also have the Philippine NGO Council on Population, Health and Welfare Incorporated, the JLO Gmail, which is the jlo.pngoc@gmail.com. Next, I am a person living with HIV working overseas. Whom can I contact? You may contact community-based organizations and support groups for people living with HIV working overseas for your questions or concerns. We have Positivong Marino. We also have PLHIV Response Center. However, for seafarers, please prepare the following information when you contact them. You have to prepare the name of the vessel, expected time and date of arrival, port of destination, and summary of concern. COVID-19, what people living with HIV should know. Isang tanong dito, are people living with HIV at higher risk for COVID-19 than other people? At present time, there is no specific information or data about the risk of COVID-19 in people living with HIV. However, older adults and people of any age with serious underlying medical condition might be at higher risk for severe illness, including people who are immunocompromised. So the risk for PLHIV getting very sick is greatest in low CD4 cell count. We also have people living with HIV not on HIV treatment or ERT. So it is very important na compliant tayo sa pag-take ng ating antiretroviral medications. And the next is the age and other medical conditions or comorbidities. If you have lung problem, if you have diabetes, and among other medical conditions. Next, what people living with HIV can do to protect themselves from COVID-19? Currently, no vaccine to prevent COVID-19. Sabi ni Doc Ramos kanina, it would take about 18 months pa before the release of vaccine for COVID-19. The best way to prevent getting sick is to avoid exposure, of course, to the virus. We also have to maintain a healthy lifestyle, eating right, getting at least 8 hours of sleep, and reducing stress. Okay. Next is regular intake of prescribed antiretroviral medications and follow the advice of your healthcare provider. And you also have to make sure that you have at least a 30-day supply. Kung ang supply mo na lang ay good for 2 weeks or less than 10 days, then at least you have to contact now your preferred HIV treatment facility for the availment of your HIV medications or other supplies needed for managing HIV. Next, what should I do if I think I might have COVID-19? So you have to call your healthcare provider if you developed symptoms that could be consistent with COVID-19. I showed on the slides yung DOH MMCHD COVID-19 Emergency Operations Center hotlines. We have Globe Smart and we also have landlines. The next is the Department of Health Interagency Task Force landlines or hotlines. We have 894 COVID or 894-26843. We also have PNP Command Center, PCC, and showed on the slide yung mga health districts natin. Ito yung mga landlines nila. Caloocan, Malabon, Navotas, Valenzuela, District 2, Pasig, Municipality of Pateros, Marikina, Taguig, Quezon City. We also have the City of Manila, Makati, Mandaluyong, San Juan, Muntinlupa, Parañaque, Las Piñas, and Pasay. So I think this is my last slide. The Department of Health strongly reminds the PLHIV community to take all recommended preventive measures to minimize exposure and prevent COVID-19 infection. And for DOH designated HIV treatment facilities to implement a client-centered approach or care to prevent yung fallouts natin ng mga PLHIV natin or yung mga loss to follow ups natin, mga patients natin.